Hello, welcome to this webinar on emotional health and lymphedema. My name is Sandra Bravo. I am a licensed professional counselor practicing in Austin, Texas, where I specialize in working with individuals that are experiencing anxiety and/or trauma. More specifically, I specialize in working with women who are going through the breast cancer journey. I was invited to speak today about what someone might feel after receiving a diagnosis of lymphedema and some interventions or coping strategies for dealing with the diagnosis and treatment of lymphedema. So I'd like to first acknowledge that this short 30-minute webinar is going to be an oversimplification of what you might receive if you were to choose to work with a therapist. But the purpose of the webinar is to give you some tools that you can use immediately. As soon as this webinar is over, or as soon as you choose to pause this webinar, you could actually try some of these interventions or coping skills for what you're experiencing currently before maybe you make the choice to work with a therapist, or if the choice is to not go that route. So in preparing for this webinar, I did a review of literature on lymphedema and mental health, and I found that there is not a lot of research out there. And in the research that I found, that same acknowledgement is talked about by the researchers. So we are learning more about it, and there is more research occurring, but we are doing what we can with the research we have. And so I looked at a meta-analysis of research. And for those of you who don't enjoy reading research on their spare time, what that means is that these researchers looked at other researchers' articles and then took their data, and then they looked at all the data to try to find some kind of correlations or themes and to find similarities and discrepancies. So this is kind of a way for researchers to get to see a lot of data quickly. And this research actually found that there were 9 major categories for what happens with someone's emotional health after a lymphedema diagnosis and then treatment. So I'll quickly name the 9 categories, and then we'll break down each category. And after I describe what the participants and the researchers disclosed, then I'll talk about some possible interventions you can try at home on your own to deal with those types of symptoms or feelings. So the 9 categories that the researchers found by looking at many different research studies were 1, negative self-identity, 2, emotional disturbance, 3, psychological distress, 4, marginalization, 5, financial burden, 6, perceived diminished sexuality, 7, social isolation, 8, unsupportive work environment, and then 9, public's insensitivity. And I'll give a bit of a definition for what these categories were. Remember, these researchers labeled these themes in this way. You might find that you would like a different label for what is being described, and that's okay. This just gives us a starting point for a place to talk about what someone might be experiencing after a diagnosis and during treatment of lymphedema. So let's start with the first category, which is negative self-identity. There were 2 subcategories that the researchers found under this theme. And the first one was body image disturbance, and then the second one, perceived disability. Now, some people might be uncomfortable with that word perceived. That word is being used here because it doesn't matter if a doctor can quantify that something is happening to your body. If you feel like something's happening to your body, it's happening. So that perceived word is not to any way imply that we're trying to discount what you're experiencing. It's actually there to say that if you're experiencing a certain sensation, discomfort, and doctors can't find a reason for it, that doesn't mean it's not happening to you. And that's the reason for the word perceived. This is kind of how researchers work. They get very specific in how they discuss how someone might feel. And you'll see that word come up again throughout our conversation today. And so let's take a look at the two subcategories. The first one, body image disturbance. The actual visual effect emotionally it can have on someone when they see that a part of their body is swollen can cause someone to feel a lot of anxiety and or depression. People may interpret that swelling as being some type of an unhealthiness, and that can scare them, especially if the lymphedema has occurred because of another health condition. And then the feeling of being unattractive can be something that causes someone anxiety and depression. The second subcategory, perceived disability. This can be challenging for someone if they now begin to feel as if they identify as being handicapped, disabled, or if the part of their body that has swelling is visible, then having other people see that and perceive it as a disability. So what can you do if you're experiencing one or both of these conditions currently? I'd like to offer an intervention I often recommend to my clients, and that is to make friends with your body and the body part that is experiencing the swelling. You may want to give that body part a name, and that's okay, because if we ignore our body and a particular body part, it's not going to go away. And it can actually feel something like someone telling you to not think about a pink elephant. Probably all of you now are thinking about a pink elephant. I told you not to think about it. So the brain goes to, oh, what did she tell me not to think about? Well, your brain's doing this when you're experiencing lymphedema in a particular body part and you tell yourself, I'm not going to think about this. I'm not going to look at this. It may actually make you think about it more often. So making friends with your body and your body part, possibly naming it, talking to it, looking at it right from your eyes to the body part, or if you need a little bit of distance, looking at a mirror, looking at yourself in a mirror and maybe talking to yourself and talking to that body part might feel silly at first, but it can be very helpful for you to accept what is happening to your body currently. There's a movement in the field of psychology that's called body neutrality. So I'm not necessarily asking you to change the way you think about the body part that is experiencing the swelling. I'm not asking you to say, now you think that this is the body part I've always wanted. I'm not asking you to do that. Some people would refer to that as body positivity. I'm asking you to move to some body neutrality, as opposed to saying, I don't like this, this looks unhealthy, this is unattractive. We would call that body negativity. Finding body neutrality of, okay, this is the way it is. It's not good, it's not bad, it's different than what I've known. What do I need to do with this information my body is giving me about this body part? It can be comforting. So let's look at category number 2, emotional disturbance. There were 8 subcategories, and these are frustration, fear, sadness, loneliness, guilt, self-blame, worry, anger, and tiredness. There's a lot here to talk about, so we're going to go through it rather quickly. Frustration, typically because an unexpected onset. No one expects to have this happen. Nobody wants this to happen. And so then it typically seems like a real quick onset. If you haven't had someone having measurements often of your body parts, it isn't until we can see something significant that we think, whoa, something's going on here. Frustration in needing to change your previous lifestyle, accepting a chronic condition, healthcare providers' lack of prioritizing the condition, and the amount of time that you will spend daily devoted to self-care. These can all cause frustration. Fear of the condition worsening, sadness due to wearing unfashionable clothing, loneliness, feeling like you're the only person experiencing this condition, because everybody's lymphedema is their lymphedema. Everything's on a case-by-case basis. So even if you met someone else that had lymphedema of the arm, you're both experiencing something different. So there's a certain level of loneliness there. Guilt and self-blame. Many people feel a sense of responsibility for their condition. They feel like they did something wrong. I just want to say again, no one as a kid says, I want to grow up to have lymphedema. Nobody wants this, nobody welcomes this. And so then I invite you today to remind yourself as often as you need to that you didn't pick this. This is something that happened. I often tell my clients, we don't pick our brain, our body, our family, or geography. We find ourselves in those situations. And then life is about learning how to use what we have found ourselves in. And so some bodies, research is beginning to show, have genetic dispositions to lymphedema. And so if you need to, feel free to blame your genes for this, if that's helpful. There's also a lot of guilt in friends and family using their energy, time, and resources to help you. There's a sense of worry, again, about the condition, how that may affect your life, how it may affect your job, possibly losing your job because you're no longer able to perform particular job tasks. Anger related to not having the space to participate in trendy fashion or finding adequate medical providers. Tiredness from the daily tasks of treating the body for lymphedema. Now, there are many other things that might fall under these categories. Again, I'm using the meta-analysis research to kind of guide this talk that I'm offering today. And so if you identify with any of these feelings or all of them, what can you do? So let me offer you an intervention or coping strategy. And that is when you're feeling anxious, overwhelmed, or depressed, any kind of strong emotion, I invite you to take some deep breaths. So we all have a part of our brain, the amygdala, where our fight or flight response resides, and that part is responsible for protecting us. And so if we feel an intense emotion, that part of our brain is going to turn on and it's going to say, what's going on? Let me look around and see, what do I need to protect you from? Our prefrontal cortex up here is our logical part of our brain that says, okay, wait, I do know that my body part is swollen, but I know that there's things that I can do about it. Amygdala wants to just freak out and say, something's wrong, something's wrong. And prefrontal cortex says, you know what, let's take a breath. So when you feel your fight or flight response kick in, what we want is a shift back to prefrontal cortex that can give us a more logical analysis of what is happening in our lives. So yes, amygdala, you're right. I have a swollen body part and it needs my attention. Thank you for bringing my attention to that. Now let me shift to my prefrontal cortex so that I can do something about what is happening. And so the quickest way to shift from amygdala to prefrontal cortex is to slow down our breathing, which slows down our heart rate and lets our fight or flight response know we're safe. Even though things may not be the way we want them, we're safe. And so I'd like everyone right now who's watching this to take a moment to just close their eyes and take 3 nice deep breaths. If you want to blink your eyes back open, you might want to check in and see, was that helpful? Do you maybe need to do 3 more breaths? Is this something that would be good to remind yourself to do throughout the day? Remember at the very beginning of this talk, I mentioned that this is an oversimplification of what might be happening to you. I want to tell you that I don't have magic here. I can't make everything perfect. But what I am offering you is I'm offering you a few ways that you can make things a little better in your life, whether that's to feel better or to feel calmer so that you can get more done. Whatever it might be, that's what I am able to offer you as a therapist. And so while this breathing may seem like a very simple thing to do, it's a very helpful thing to do that at times can feel like I can't take a breath, or I'm holding my breath. I can't even think about breathing. And so constantly bringing us back to our breath is a great place to rest when life feels overwhelming. So let's go to our 3rd category, psychological distress. There are 3 subcategories: depression, hopelessness, and helplessness. So now, I wasn't quite sure how the researchers were using the word depression. I know culturally a lot of people talk about, oh, I'm so depressed, when really what they mean is I'm really sad, or maybe they're saying I'm grieving the loss of someone. When therapists talk about clinical depression, we have some very specific criteria for using that type of language. So I'm going to say that the researchers were not talking about clinical depression. They were talking about intense sadness. And so what came under this subcategory was sadness in how your resources, time, and energy are being taken away from hobbies to care for the lymphedema. The hopelessness for there being no cure for this condition, a chronic condition that needs lifetime maintenance. And then helplessness, which is daily treatment may not improve your condition, or the current treatment's not improving your condition. So what do you do when this happens? Well, this definitely feels like overwhelming. If I'm not getting to do the things I wanted to do, this is not going to end, and nothing's working right now. That feels very psychologically distressing. So how do you process those feelings? I think if you're here, this is a good time to reach out to a therapist and work with a therapist or a trusted friend or spiritual guide in your spiritual community. If you don't feel like you have that, or it's 1 p.m. or it's 1 a.m. at night and you wake up and you're stressed out, I highly recommend getting a journal. And now a journal is not a diary. It's not about, this is what happened to me today. Like maybe you had a diary as a young kid chronicling your day-to-day life. This journal that I invite you to have is going to be a journal more about how you're feeling. It's going to be a place where you can just get everything out of your head and onto paper so it's not causing so much distress in your brain. And you're welcome to maybe put some pictures or quotes in your journal. You're welcome to maybe put some people that might be an inspiration to you. This is Polly Murray. She was an Episcopal priest. Maybe some of your drawings if you want to draw in your journal. You might want to put some charts for morning yoga. I want to do some yoga and I need accountability. You might want to put some just straight writing in there, whatever works for you. But the journal's yours, and if you're worried about someone reading it, I invite you that after you write in it, just rip up the pages and throw them away. That's okay. This is for you, not for anybody else. Let's go to category 4, marginalization. So what is marginalization? It is being part of a smaller group of your community And being part of a smaller group in your community means that smaller group might receive less resources from the government or other community agencies. And so what do you do if you're part of a marginalized group? Well, the first thing I'll recommend is finding a support group of other people that are going through what you're going through. And that can help you feel less like you're alone in this. The second thing is get politically involved. Maybe you can help educate other people. Write to your politicians about having more money sent to research for lymphedema research. Whatever you feel you would like to do, I encourage you to do that. It'll help you feel that power that you might not be feeling currently. Let's look at our fifth category, the financial burden. So this has to do with what if you don't have medical insurance, or what if you have lots of limits on your insurance compensation for compression garments or physical therapy, or a mental health therapist. What can you do? Number one, find a social worker for the hospital or clinic that you are working at, or find a nonprofit for the type of condition you have, and reach out to them to get support, referrals, and resources from for-profit or nonprofit organizations. Something else you can do to help you feel empowered is make a budget. Oftentimes people think, I haven't made a budget in a long time. You might not be in the situation you think you're in, so seeing it on paper can be helpful. Just exploring your finances can be helpful. Even though it may be scary, there's still comfort in knowing and having information. Then you can decide what you're going to do with that information. Let's look at the sixth category, perceived diminished sexuality. Feeling unattractive to your spouse, partner, or the community, loss of spontaneity in sex life, and difficulty in foreplay. So what can you do? Well, I would offer you this. Number one, reframe your situation as an opportunity to try new things in your sexual life. Maybe this could mean finding things you enjoy even more. Reaching out to professionals can also be helpful in this type of situation. Getting more information. For some people, this might be really uncomfortable. They may not be comfortable talking about sex. And so that'll take some courage, but sometimes taking a risk to ask a courageous question can have great payoff. And so you can ask your doctor, your therapist. There are some therapists that specialize in human sexuality, or maybe your support group, but asking questions can be very useful. The seventh category is social isolation. This is about having less energy and time to attend social events. This could be about avoiding social outings due to displeasure with your personal appearance. And so then I will tell you as a therapist, the one thing that we warn people from doing is socially isolating. This will lead to depression eventually in anyone. And so finding what you feel comfortable with and starting there is very important. And that may mean, again, a support group with other people who are going through what you're going through. An online group might be helpful too. You'll feel more comfortable if you're at your home meeting with other people and knowing that you can turn that off at any time. Let's look at category 8, unsupportive work environment. Employers' lack of knowledge about your condition and or coworkers, and then coworkers or supervisors unwilling to help with job tasks. Now, this is a very tricky situation, and I just want to remind you, I'm a licensed professional counselor. If you feel like something that is happening at your work is crossing the line to your job, doing something illegal, violating job laws, I encourage you to reach out to maybe someone in the legal system that can help answer those questions. But definitely go to someone who knows what your rights are. And maybe talking to your supervisor would feel comfortable, But maybe it's not. Maybe you don't trust your supervisor, and that's okay. But always going to a person you trust to explore what you can do with the situation. And the ninth category is the public's insensitivity to your condition, such as people talking about your condition in public where other people can overhear you, or people asking to look at your body part, whether in your home or in public, thinking that they have the right to see that. Please know that your body is your body. You don't have to show anyone any part of your body you don't want to. I like to separate the difference between secrets and private. Secrets are not healthy, so I don't like people to keep secrets. Secrets are information that could eventually hurt someone. So, for example, if you don't let your doctor know that there's a part of your body that's swollen, that could be considered a secret because that could hurt you in the long term. Private would be not showing a certain family member or friend your body part. That's private. They don't need to know that. It's not going to hurt them because you know your doctor is taking care of that. And so sometimes you may have to use your voice and let people know that you would appreciate them not talking about certain things in public. And I know it feels like I shouldn't have to do that. You're right. But sometimes if we want someone to stop doing something, we need to very explicitly let them know. Can we not talk about that in public? Or I'd prefer people not to overhear this. It's okay for you to do that. Again, that's living into your power, and that can help really lift your spirits to take that sense of control in your life. And that is one of the things that I think the diagnosis of a lymphedema causes people to feel, a loss of control, because your body is doing something you don't want it to. Another thing I often hear is people talk about how their body has betrayed them. And that's definitely something to explore with someone you trust, talking about that. Getting it out of your head, whether it's by speaking it, writing it in your journal, maybe painting or drawing, whatever works for you. The last thing I'd like to talk about is how to deal with setbacks. When setbacks happen, that can feel very overwhelming. And oftentimes I've heard people say, if you think that the setback is you doing something wrong, then you're definitely going to feel bad about it. But if you can see a setback as an opportunity to teach you what didn't work, then you can see it as a good thing. And so this is what we would call growth mindset language. As opposed to, someone did something wrong. You can say, well, this didn't work. What did I learn from it? And I'm not going to do that again. That's growth mindset. And so I invite you to try using some growth mindset language. If you want to know more about that, you can probably put that in a search engine online and get more information. And again, while this was a quick oversimplification of what someone could do if they receive a lymphedema diagnosis or are receiving treatment, I wanted to offer something today, some concrete things you could do as soon as you sign off on this webinar. If you're needing more assistance, please reach out to someone. There are people that are here to help you and that want to help your life be a little bit calmer, easier, and less burdensome. But we don't know that you need that help if you don't reach out to us. So once again, thank you for inviting me into your life. Please feel free to reach out to me if you have any questions. My website is sandrabravo.org. That's SANDRABRAV as in Victor O.org. And I hope that I was able to give you something to give your life a little bit more of peace for today and each day after.